Hi, this is your Somerset County, New Jersey chiropractor, Dr. Perry Wolk-Weiss, coming to you from the Get Well Center in Bound Brook, New Jersey. I'm here today with Danielle, who's 20 weeks and 1 day pregnant with her first child. So she's really excited about this, and it's getting to the point now where she's starting to feel a little bit of lower back discomfort. She has a little bit of a headache today. But Danielle, why don't you talk a little bit about what you've noticed chiropractic has done for you being pregnant?
Sure. Well, I started coming about a month ago, and I came in initially because my headaches were every single day, 24 hours a day. So I started to come, and the chiropractors helped me with my headaches, and also my lower back, my upper back too, and my neck. It's pretty much everything that's helped me with.
And you know, when you're pregnant, your body changes a lot in a bunch of different ways. More importantly, from a biomechanical standpoint, what happens is, as you get a little bit bigger up front here, it puts more stress on the lower back. Also, about 15 weeks into pregnancy, the hormone relaxin kicks in, and when that hormone kicks in, all the ligaments of the body start to stretch out, so your pelvis can widen, which can make it easier for delivery down the line. And that creates other problems because you now change your center of gravity. With a change in center of gravity and looser ligaments, it's easy for the pelvis to go out of alignment. So one of the things I check on Danielle all the time is make sure her pelvis is in alignment and not out of alignment. Now this table we have here is great because the middle section can drop down. So right now, even at 20 weeks, we can still get her to lie on her stomach without having any kind of risk and stress to the baby at all. And that's what we're going to do. So we're going to lay her down, we'll do some gentle adjusting on her, we're going to check her leg length and see how that's doing, work on her neck because that's putting a lot of stress on her shoulders now as her body's starting to change. So let's take a look at that. So we're going to get you to lay down on your stomach. Let me just drop this down. That's good. That's good. There we go. Good. Slide down a little bit. Is that comfortable for you? Good. So yeah, our middle section drops down a little bit here, leaves nice room for the belly. First thing we're going to do is check her leg length, and her pelvis is definitely off. You see a shortness on this side, which means that this hip bone here is rotated backwards, and this hip's gone forward, so that puts a lot of stress on the lower back. So what we're going to do is we're going to put this right here. Good. And we're going to put this right in here, good, like that, and that'll help balance her pelvis out and take a lot of the stress off her lower back. Now unfortunately, since her pregnancy creates changes in her pelvis, it's not going to stay for long, but it'll stay for a few days, at least a week. It may go out again. It all depends on what she's doing. So we're going to take these out. That's all we need to do there. And a lot of stress in the upper back here, which is what contributes to her headache, because as this belly gets a little farther forward, it puts more stress up here. So we're going to take a deep breath in, let it all the way out, nice and easy. Good. One more. Let it out. Good. Better than I expected. So now what we're going to do is get you to turn on your back for me. I'm going to raise this up a little bit. Great. Good. Good. Okay, we'll raise her up a little bit. How's that feel there? A little tender?
It's tender.
Yeah.
It's tight.
So her C1 vertebrae is out of alignment, and our adjustments to the neck are very gentle. We don't do a lot of rotation. That's why we want to put anybody at risk. And turn your head a little bit, nice and easy. Good. Good, excellent. That's all it takes. It doesn't take much. A little stretch. Drop this down a little bit. And let me get you sit up. Let me help you up. At this point, she needs help up.
Yes.
So we're going to have her cross her arms. Once again, because of the change in the front, it puts a lot of stress on the upper back, and this is a really important adjustment. Come on back. Nice and easy. There we go. Good. Excellent. Better. Now, one other thing I want to check, because sometimes in pregnancy, the bones of the skull, and it can happen actually even if you're not pregnant, the bones of the skull can jam up. So anybody having a headache, sometimes that can be off a little bit too. So I'm going to have you lie back for me. I'm just going to check that. Give me your left arm. Just hold it up, push against my hand. And she's good, so there's no problem with that. So let's get you back up again. That's good. All right, good. So it feels better?
Yes.
All right, good. So that's how we adjust pregnant patients in the office. Real gentle, they do great. Remember, you know, you're pregnant, you got someone growing inside of you, boy or girl. She hasn't figured that one out yet.
Tomorrow.
Tomorrow's the big day, you'll find out. So this is Dr. Wolk-Weiss from Somerset County, New Jersey chiropractor at the Get Well Center saying stay healthy and have a great holiday.